welcome back to another episode of Driscoll Decoded. My name is Angela, and I am your host for today's episode. So today we're talking to our pregnant moms, if you're thinking about getting pregnant, postpartum, everything like that. We have Dr. Doucet here back in the pod.
Hello, everybody.
Our infamous Dr. Doucet, thank you for joining us.
Absolutely. Happy to be here.
Yeah, so we have a very interesting topic here. Something that you brought to our attention that needs more attention to the mass over here. So aspirin therapy.
Yes.
Can you elaborate just a bit of that title and where that came to be?
Yeah. So aspirin therapy hasn't been a new thing in obstetrics in terms of helping mommies have healthy babies and healthy pregnancies. But there's a big push recently by the March of Dimes as of May of last year. And their campaign is called Low Dose Big Benefits. And essentially, the drive is to prevent preeclampsia, which in turn prevents preterm delivery. Okay. So in Texas, unfortunately, we don't do a great job in terms of preterm delivery. In fact, if you look across the United States, Texas lands category D in a scale of A to F.
Oh my gosh.
And so there's a lot of room for improvement. And I came across, I know high-risk pregnancy. I'm, as you know, a hospitalist in a hospital. So I'm dealing with the emergent cases of these complicated patients. And I always ask, are you taking aspirin therapy? And they're like, no, I didn't know anything about aspirin.
Yeah.
So there needs to be more education to patients of who would qualify for aspirin therapy, as well as we're doing a big initiative with Driscoll Health Plan in going out to providers and doing a lecture series to help them learn more about it.
Yeah.
But it all has to do with preeclampsia and prevention of preterm.
Okay. So I know as we've talked many times, I didn't hear anything about aspirin therapy. Granted, I'm blessed with I didn't have to worry about preeclampsia, but just to know that it, now correct me if I'm wrong, delays or prevents preterm.
Right. So aspirin therapy does several things within a woman's body, and particularly the placenta, which is the organ that feeds the baby. It helps flow, it helps oxygen, it decreases inflammation. And so these are all factors that are contributed to elevated blood pressure in pregnancy. Whether a woman already has high blood pressure before she heads into her pregnancy or develops it within the pregnancy, like what we call gestational hypertension or preeclampsia, which is associated with protein in the urine. But there's many risk factors associated with women who might develop these complications in their pregnancy. And they could be a mom who's young, who's never had a baby before, or maybe a mom who's been pregnant and dealt with preeclampsia or gestational hypertension in previous pregnancy, or maybe a mom had a baby that was small or growth restricted and delivered early. I mean, all these diabetes in a pregnancy, pre-gestational diabetes. I already mentioned hypertension, or moms that have like kidney problems going into a pregnancy. And then there's also a subcategory of like women who are overweight going into their pregnancy, like a body mass index over 30.
Yeah.
So for those of you who don't know what that is, that's a measurement of your weight and your height, and your doctor can tell you what your BMI is. Maybe there's multiple gestation, like twins or even triplets. Those are patients who qualify. Or moms who are older in age, over the age of 35.
Oh, wow.
Or if you're African American, if you're Black American and you're pregnant, you are at risk for preeclampsia. So there's a whole list of complications. If your mom had preeclampsia, or you had a sister who had preeclampsia.
Wow.
So there's a whole list of high risk factors, and then there's a list of moderate risk factors. And these are all things that are very important to bring up to your provider, because maybe you would qualify for being on a baby aspirin a day to prevent these issues.
So how come our providers are not talking about it? I know there's probably something that is well known, but how come we're not hearing it?
So 2014 is when it became an acceptable intervention. And then there was a resurgence of that push in 2021. So I think part of it is that a lot of our providers are very busy, and they're seeing many patients all in one day, and it may have been overlooked, or maybe they mentioned it in passing but aren't reiterating the fact that that's a therapy that needs to be started. And a lot of people aren't reading current guidelines. So part of my job is to go out there and help educate people, and whether it be the patient or the provider, so that we're all on the same plate, the same game plan to help the mom have a healthier pregnancy, decrease her risk of preeclampsia, and a healthy full-term delivery.
Yes. So from that list that you gave, it's very, not broad, but there's so many factors that can go into, wow, I have this, or like you said, my mom may have this, so I can qualify for the aspirin therapy. What about the aspirin that makes it, function the way it does in our body? How does that work, if you could break that down?
Well, so it's technical.
Okay.
So there's something called thromboxane A2, cyclooxygenase. Basically, it's helping the blood system flow better through the placenta, through the umbilical cord to feed the baby. Okay. And so if you're taking an aspirin a day, most people think of an aspirin like an anti-inflammatory product to keep your fevers down, all those things. But these are inflammatory markers that affect the blood vessels within the umbilical cord and the placenta. Okay. And so if we can decrease the inflammation to that organ, we have better blood flow. If you have better blood flow, the baby's getting better nutrition, better oxygenation. And so, but also it helps in mom's system, because if she has decreased inflammatory factors, then maybe she won't develop elevated blood pressures in the pregnancy because of these anti-inflammatory effects. So it gets very technical, but the bottom line is decreasing inflammation, improving blood flow to get a better outcome. That's the goal. And in terms of the aspirin, this isn't regular dose aspirin, which would be like 325 milligrams on average. This is baby aspirin. This is 81 milligram tiny dose. We talk about low dose, big benefits, and that's the push. It's a baby aspirin a day. So the way I think about it is we're very good at taking our prenatal vitamin, hopefully every day. If you're diabetic, you're taking your metformin or your insulin or whatever you're taking to prevent that risk of complications. So this is just adding one small dose of extra benefit in your daily routine.
Okay. So say a mom is watching this, or someone who's thinking about getting pregnant. Even if they don't know, what they may have or any of those signs or those symptoms, can they just say, okay, well, I'm just going to start taking baby aspirin? Yeah,
I wouldn't recommend that. I would recommend for them, even though it seems like all those risk factors I talked about is like everybody should be on baby aspirin. It should be in our water supply. And that's not what I mean. What I mean is they should bring up these risk factors with their provider and have that discussion whether or not they fit criteria. When you look at our patient population here in Corpus Christi and surrounding areas in South Texas in general, a lot of people already hit those markers. But I would never want a patient to initiate a therapy without talking to their provider, because there is a window.
Okay.
And the window is between starting it after your first trimester, like at that 12-week mark.
Yeah.
But it's most effective if it's initiated before the 16-week mark. Okay. So starting between 12 and 16 weeks and maintaining that therapy all the way to the end, even to delivery.
Oh, wow.
So, but these are all little details that need to be discussed with their provider. So the importance of going to the prenatal visits, rediscussing, do you still want me to take the baby aspirin every day? Yeah. If you are high risk and you're already seeing our maternal fetal medicine experts in the community, they guarantee they're talking about aspirin therapy, because I've spoken with many of them. They're like, they're not taking their aspirin, and I have to remind them to take their aspirin. And some people have barriers because they think, well, if I'm going to have aspirin therapy, I'm going to have bleeding problems. Yeah. And all the research shows they're not at increased risk of hemorrhaging or complications at C-section or whatever. It's just a small little dose, but it makes a huge difference.
For sure. I love those points that you bring up. Just make sure whoever's watching this, advocate for yourself.
Yes.
Advocate. But don't make any moves until you see your provider.
But also, to reiterate on that, on your talking points, that is keeping your prenatal visits.
Yes.
Right? So going to your prenatal care and even your postpartum care. I mean, all those things. Women who develop gestational hypertension or preeclampsia, or God forbid, severe preeclampsia or even eclampsia where they can get seizures, these are all complications associated with elevated blood pressure in pregnancy. those moms should be seen within 48 to 72 hours after they deliver. So let's say they delivered vaginally on one day, had a natural vaginal birth, they got discharged the next day, but they had blood pressure problems. They need to see their doctor or their nurse practitioner within a day or two of discharge to recheck the blood pressure. So these are all things that people don't really know. And they're, oh, my doctor said I didn't need to be seen for the next 4 or 6 weeks. These patients are unique because they can develop, about 15% can develop postpartum preeclampsia. So seeing if they've had a little bit of elevated blood pressure while they've been during their delivery phase, whether it be a C-section or vaginal delivery, they need to be seen within 2 or 3 days after delivery, not only just for preeclampsia screen, but are they having the blues? Are they having depression? Do they have problems meeting transportation needs? I mean, there are other issues that the provider can be asking. So yes, our focus today is on prevention of preeclampsia and aspirin therapy, but it's a bigger picture. So keeping continuity of care, going to prenatal visits and postpartum visits, that's super important.
Definitely. And I feel like maybe, and I might be wrong for some people, but what could possibly freak some moms out, like, oh, they hear therapy.
Yeah.
So they're like, oh, aspirin therapy, like it's just another thing I have to be worried about, or another pill I have to be taking, like you said. But it's just a baby aspirin that can significantly better.
Yeah, it's a huge impact.
Yeah, it's a huge impact.
Yeah, it can decrease their risk of preeclampsia. Let's say a woman's had preeclampsia in her first pregnancy and she's pregnant again. Her chance of developing preeclampsia in this particular pregnancy can be decreased by 20 to 25%.
Wow.
So, I mean, it's a huge intervention.
And remind the viewers again, what's preeclampsia and what can it cause?
Okay, yeah. So there's different, I should correct myself. It's really the gestational hypertension. There are hypertensive disorders associated with pregnancy, and there's a whole category. So hypertensive disorders could be something like gestational hypertension, where they just develop blood pressure problems, but they're not developing any other issues like protein in the urine or changes in their liver function studies or their kidney function. So it's just blood pressure isolated. If they develop blood pressure problems and then they have protein in their urine, well, that develops into preeclampsia. So it's a different name. It's all nomenclature and semantics. And then they can develop like superimposed preeclampsia if they have chronic high blood pressure. We now call that hypertensive with severe features. I mean, there's all these different nomenclature, but you guys don't have to worry about that. That's for us as providers to be worried about. The bottom line is monitoring for their blood pressures, checking at home if they're high risk, and usually their providers will talk to them about monitoring and keeping a log, staying healthy, losing weight before you get pregnant, or when you're pregnant and you already are on over the BMI of 30, maybe watching your calorie intake. We like calorie intake to help the baby grow, but you don't want to gain too much in the pregnancy.
The right calories.
Right. Yeah. Exercise is beneficial. I mean, all the interventions to watch for signs and symptoms of hypertensive disorders in pregnancy is important. So, and again, keep in the prenatal visits.
Definitely. Yeah. Definitely. And if anyone is needing help with getting prenatal visits, they can always, especially for our Texas residents, you can call 211 and get connected to the Health and Human Services Commission.
211 will connect them up to get registered for Medicaid. And then once they have their Medicaid, then they can start their prenatal care. And that is a process. So waiting for the state to reach out to the patient, it's not going to happen. The patient, in my opinion, has to be the squeaky wheel and just call 211, 211. And I mean, I don't know, I think I should just put that on my lab coat when I'm on call, like call 211, because I'm seeing a lot of patients coming in who don't get prenatal care, and that's not the best case scenario because they haven't sought care through their pregnancy. Maybe they have a problem with their baby. Maybe they've developed blood pressure problems in their pregnancy, and we're catching them on the back end. So being proactive and initiating care, that's super important. Definitely. 211.
Yes, and I'm big on the screen, 211.
211.
And if you do have Medicaid and you're not sure which doctor will take the Medicaid, call the number on the back of your card. There's usually like a 1-800 number of whichever plan you may have, and they will direct you to see which doctors will take your Medicaid. And take it from there. Just be proactive in your steps, whether that's setting up the appointment or making note of the signs and symptoms that you may see that your history has, and take that baby aspirin as directed.
Yeah,
yes,
as
as directed,
yeah.
please. But bring that up, advocate for yourself. Dr. Doucet, thank you so much for bringing this.
Two other plugs. So
Yes.
if you want more information, you can go to the Hear Her campaign, and that will also link you up with just different educational materials for you guys to look up, and also Low Dose Big Benefits. Those are both March of Dimes campaigns, and they have resources for anybody, for providers as well as patients, so they can get more information if they have any questions, or give us a call at Driscoll Health Plan.
Comment below if you have any questions regarding anything we talked in this podcast, or any questions you would want for us to ask Dr. Doucet for our next episode. But yes, do the research, get on the website, look up the Hear Her campaign, March of Dimes, Low Dose, Big Impact. There's a ton of information out there for you, especially if you're a loved one just hearing this. Pass the information on. It's super beneficial, not only for mom, but for baby as well.
Absolutely.
We want to make sure both, get to that healthy
Full term.
start of life.
Regular nursery.
Yes.
We don't want any NICU babies, for sure. We want babies going home with their mommies. So.
Yes, definitely.
Yeah.
Well, thank you for joining us
Absolutely.
here
Thanks for
today.
having
It's a
me.
shorter episode, but big impact right there.
There you go. Love it. Love it.
Thank you,
so much.
everyone. Yes, thanks for joining, and we'll see y'all next time.
Okay.